Well, welcome to another edition of the Sigvaris Cafe, and this morning we have with us Dr. Deol, and she's joined us for a little tour of the factory here, and I thought we'd just start out by maybe having her introduce herself and tell us a little bit about herself.
Absolutely. Hi, I'm Dr. Deol. I am the Regional Medical Director for Center for Vein Restoration in Southeast Michigan and Ohio. I'm an endovenous surgeon by training, double board certified in general surgery and the American Board of Venous and Lymphatic Medicine. So I see a lot of patients with both venous disease and lymphatic disease, and I use a lot of compression products and pumps in my practice, and it was just a wonderful opportunity for me to actually not only learn that these are Sigvaris products are made locally in Michigan, in the state that I love, but that they're also hand-sewn old school style.
That's right.
I never knew that. So this is wonderful. There was an opportunity for me to see the family members here, you and your sister Caramel, and also Keith and his son John. Yeah.
Also works here.
So homegrown and family run.
Well, it's great that you come out and join us. We're really glad, and that's what we do here at the Sigvaris Cafe. Is, of course, we enjoy great coffee with our compression conversation, and I'm glad to hear that you work with compression a lot. That's what we're all about here. So you had mentioned a patient that you've been working with, and one of the things that we do here at Sigvaris is we make, as you said, those sewn custom garments to fit very difficult patients, acute lymphedema, stage 3. So tell us a little bit about that person.
Okay, so that person actually represents a lot of my practice.
Okay.
He's a difficult patient, but my two offices, I have one office in Southgate, Michigan, and a second office in Oregon, Ohio, which is basically Toledo, suburb of Toledo. And I have those two offices for the express reason that I treat a lot of the auto industry. And my patients are the hardworking American who is on their feet, double shifts, 7 days a week, their entire life until they retire, and their day off is their first day of retirement. So that was my purpose of opening those two offices. And these patients, being on their feet and being on the lower income scale, have the highest incidence of venous disease and lymphatic disease. So my patients are all difficult patients.
Right.
And so with this patient that I'm telling you about in particular, he has what's called MLL, massive localized lymphedema. And some people know it as lobular lymphedema.
And we do have a picture, right? So
We do.
We'll put that up on your screen.
So he came into my office basically challenging me to help him. He came in and was very standoffish and just said there's not much I can do. As a free screening event, and I took a look at his legs and saw that he had both venous disease and lymphatic disease. And I gave him a brief talk and education about it and offered him an appointment. And it took him 2 months to actually make that appointment because he seriously didn't believe that I could help him.
Yep.
And he came in for the appointment, we did his ultrasound, and sure enough, he has venous insufficiency. And I described to him what he needs to do to treat his lymphedema and his venous insufficiency. And I'm happy to say he did schedule treatment, and I did his first procedure this week. He was very grateful, and actually I think his the most moving part about this was he broke down and was in tears when he realized that there was somebody that was actually willing to offer him hope. And he said to me, "Doc, I don't expect you to cure me, but if you can somehow get this leg smaller for me," he said, "I promise I'll do whatever you want me to do." So he went from being a very resistant patient to, "I'm going to do anything you want me to do." And I've been thinking about the different pumps that I can use for him, and I have to say, probably the best part about being here today was to realize there's a garment that I can offer him that I didn't know existed.
Right.
And you can show me that, because this was wonderful.
Take a look at that, and as you look at the picture that we showed, you can probably see how this might be beneficial. But so this is the MedAssist line. We call this the LegAssist LCS, lobule control system, and so that would be the massive localized lymphedema would be the medical term. We kind of refer to them as lobules or lobes. So the idea here is to provide an inelastic garment that has a foam layer in it and is custom made to the shape of the patient. So this has a ridged, soft ridged open cell foam, and it has this unique design that contours around with this piece, Velcro piece that gets underneath the lobe, lifts, and then the Velcro adjusting straps will then circumferentially compress. So this is the optional hip attachment and belt that goes with it. So that's kind of a complete thigh unit. So this is something that you just saw for the first time today.
I did.
Right?
Absolutely, never knew it existed.
So
Yeah, and what I thought was even more impressive, the way I describe to my patients how they treat lymphedema with the pump. So I'll tell them, I'm not going to spill it, am I?
yeah, it box a little bit. We need a new table, John.
Waiter. So what I'll tell them is, I say, you know what, when you're cleaning up after dinner, you're going to wring out your sponge at night and then you sit it on the countertop and let it air dry, right? And they say, yeah, absolutely. So I said, that's what your pumps are for. You know, the pumps are going to basically squeeze your leg, wring it out, and then you let it air dry. And what you want to do is keep compression on that now freshly squeezed out leg to prevent them from filling back up with fluid. And up until now, I didn't think there was anything that I could really put over somebody like my patient that I'm showing you in that big upper thigh area. So what I would tell them to do is before they drop their leg down out of bed in the morning is to put their compression garment on then so their leg never has a chance to fill up. But for somebody with this condition, to have that in addition to the pump, I think would be a quicker recovery for them.
Right.
Right.
And that's what we hear quite often is that it's used to manage the progress that's achieved with a pump. So the intermittent pneumatic compression will help them to reduce, and then this maintains that progress. So the two do work very well together, we found over time, and they can get quite a bit of reduction. So what we'd like to do is actually maybe revisit in another webinar down the road, and hopefully we'll see a vastly different picture of this patient, and we'll see something that has reduced immensely.
I would love to do that. And also, I did ask this, but I want to ask it again. Is this something that he can wear during the day while he's up and about at his job?
That's a question we get quite often, and yes, they can wear it during the day. It is bulkier than a stocking,
Okay.
but it's intended for nighttime use, but it's safe for day or nighttime, and it's effective certainly during the day because that's when they have more muscle activity, and so they get more compression really out of the garment. So nighttime is really for management. Daytime they'll actually get more reduction because of their muscle activity. So yes.
All right. My job is to talk him into wearing this and complying.
All right.
And then after that, I'm going to ask him if he wants to actually come on here and speak a little bit if we are able to get success. So I'm hopeful.
Well, good.
Thank you.
And we will certainly give him a great cup of coffee if he comes out. We'd love to have him out, but we'd love to see his life, really improved by just reducing the size of that leg for him. So that'd be wonderful. So we'll work on measuring and getting him the right product. And as he said, he's more than willing to comply.
Right.
And so that's also a big key to success.
It is.
And we'll look forward to having another webinar and having another great conversation with great coffee here at the Sigvaris Cafe. Thank you.
Thank you.
Thanks for coming out.
Thanks for having me.